Welcome to the first Women in MedTech podcast of 2025. I'm your host, Colleen Patterson, and with me today is Abby Norfleet, Barbara Strain, and Stephanie Pitts. It's been a while since we've had our last episode. I think it's been a couple months now. I was out for a bit following surgery. Then, of course, the holidays happen. And the next thing you know, here it is in January, middle of the month already. The time is just flying by. The MBA podcast that was just published last week did cover some of the same trends to watch from the perspectives of the team members for what's coming up in 2025. And our team's going to be diving into a pretty similar topic, but we're really going to be looking at some of the research trends and where we're seeing the industry shifting to. Really looking into where we think those key change dynamics and where we should be watching and preparing for in 2025. So team, what are we seeing out there?
Well, Colleen, I'll dive right in. I'm not afraid to kick it off. Great to be back with everybody. Happy New Year. Happy 2025 to everyone. It's going to be a wild year. I'll tell you one thing that I've got my eye on, and it's really my New Year's resolution. I threw it out there on LinkedIn, is all things AI. We can be afraid. We can be afraid of the future and afraid of the change and afraid of what this brings, or we can just dive in. And I feel like a kid in a little ball pit, and I'm diving in all areas of my work and even my personal life, looking at AI through, just even some of my personal aspects, like on my iPhone and different things like that. So that's what I hit on today in a little bit more detail.
Yeah, I was going to say, completely agree. I think that there has been some really significant improvements when we're talking about what AI looks like. Some huge case studies have come out recently. Stanford just did one about the efficacy of AI reading and interpreting clinical test and lab results, as well as doing patient care. And although generative AI, I don't think MedTech is there yet where we're predicting things. But when you're really looking at being able to address a lot of those administrative concerns, this is what I think is going to be a transformative year for AI. What do you guys think on how that will impact, one of the big concerns that we've talked about over the last year of, what's going to be the healthcare worker shortage? How do you see AI impacting that?
Well, going back to your comment about how I agree with you. I don't think that we are anywhere prepared for it to be generative AI. In fact, in the way that it's going to hit the healthcare industry market. Obviously, there's a lot of other industries where that's already starting to make sense. If it is being deployed in any healthcare tech companies, I think it's going to be more around the development of patient education and maybe some of the marketing concepts or marketing strategies that these companies are offering. But we're seeing AI deployed not just within, technologies that are being released, but it's the companies that are bringing AI into their own backyards as well, and being able to govern that themselves to maybe enhance the innovation as far as that goes. But as far as my thoughts on where we're seeing with all of that, I think the biggest driver is going to be the companies that are going to be very good at keeping up with the regulations that are already put in place and how often that they are already changing. So I think the most recent one is going to be they have to release every month, I think, at a minimum. So whatever strategies that they're able to put in place to keep up with any of that pre-validation so that they're not having to do all these recalls. AI has been very, very interesting to me. Obviously, when we had the MedNation company on late last year, I've enjoyed watching any of those companies that are releasing that. So I've been watching it for quite some time. But one of the things that I did find astounding was the amount of recalls that occurred on software specifically from 23 to 24. Of a 50% increase. I think that was in one of the articles that you sent, Colleen.
Yeah,
and it's a little frightening to think about when it comes in terms of the implications that some of these technologies are trying to guide and direct. So the healthcare shortage workforce, to kind of get back to your original question, can obviously be enhanced, but we still are going to have to really rely on people that still know their stuff within these clinical settings, as it's directly impacting patient care at the end of the day. Any of the companies that I have been following closely that I think are doing AI well within healthcare are still very adamant that they are not replacing people. They are enhancing and improving their ability to do work, but they're not replacing people. So down the road, maybe we can get there. But my concern is, those companies that don't do a great job and are going more on proclamation versus actual results. I get a little skittish around that.
I mean, there's definitely some factors there, Abby, about the fact that innovation has been outpacing regulation. I think that this is going to be a year in which we're going to see some of those changes, especially, we are talking about a governmental regime change. It was really actually surprising to me that during the campaigning last year, I didn't see a lot or as much emphasis on healthcare and the change that is needed to address some of the systemic, items that are happening in the background. And I thought that really AI had an opportunity for that. For Barbara, for your perspective on this, there have been so many studies about things like, AI being better at reading cancer results or radiography films. How do you see AI kind of fitting into that puzzle?
Well, there's two big pieces to that. AI in radiology and some other areas like that have been available for many, many years and have increased the ability to find, small little tumors or small defects or improvements in things so that you don't either over-treat or under-treat things. So that's been available, so it's well-known and accepted. The big thing that I picked up in a couple of surveys that I actually did at meetings, and it was recorded and I had results and things, is access to data within their own organizations, and not only access to data, but how accurate is it, how accessible it is. And you can't have good AI unless your clinical data, your financial data, any of those other pieces of information are not all aligned. So you will be, garbage in, garbage out type thing. So you do have to be careful how you're using it and making sure that what you're putting into it is valuable information that is accurate.
I think that that's an excellent point, Barbara. And one of the things I would say that I'm most excited about, especially when it comes to AI and the ability to help create a cadre of evidence, is such a big emphasis of what we talked about last year is the lack of study or information or background of data on those people of color, of women, of the different demographic cohorts that have been underrepresented. And I do think that there's really a possibility here where an enterprising organization could put together some really groundbreaking research without the same lift that would have been the case 5 years ago to create new standards of care. And when we're talking about how to really innovate change within MedTech, we're not talking about changing from purple to blue or, like those incremental changes that people used to whip out and be like, oh, buy my brand new products. It's about how do we really transform what the healthcare landscape looks like. And I think AI is going to be part of that story. One of the other factors of where I see AI going is the trend that I've been seeing in personalized medicine, specifically hyper-personalized medicine. Of really, there's been more evidence in the last few years about moving from that, fee-for-service, one-size-fits-all, models to that real, based on genetic testing or other items. How do you guys see that impacting, or what opportunities are going to be there for that 2025 year?
I think there's a lot of opportunity just because there is so much data in your own organizations that you don't have to wait really for these studies that might take 3 years, 5 years to be done. If you combine your outpatient data, inpatient data, and apply the right AI and other sort of ways in which you calculate, you will have your own sort of internal standards that you can set in things. My own primary physician does that through his ACO that he's part of. So all those members' data are in there, whether they're primary care, outpatient, or whatever. And so he has the trends and stuff for our region and demographic. So it's there. So you don't have to wait for lots of these studies.
I think another element of that, since bringing up the personalization of medicine, and as we have talked about before, how behind we feel they are in the minority groups. Hopefully that does give us, as you said, the ability to catch up a little bit more quickly. When you look at how many devices are out there, the wearables that are streamlining straight to an app, that now you can connect their apps to your actual personal EMR that goes straight to your physician if you want it to. You're catching your watch data that's constantly monitoring your heart rate, or those that are wearing the continuous glucose monitors, whether they're diabetic or not, or they're just trying to, those biohackers that are out there doing all of that. There's an insurmountable amount of data that is starting to go into a lot of these organizations. Now, of course, if they're doing good due diligence and the right proper validation, they're going to understand that there's a level of variability that's going to come with that each user, and how often they're wearing these things, and if they're doing it properly, and what their actual lifestyle is. But it's another interesting element. And it's one of the things that I like to tie into, again, referencing one of the articles that you sent, Colleen, where they talked about Mark Cuban's, the Cost Plus Drugs company that he launched. And
industry disrupting.
Years ago, he went on record and saying, listen, data is going to be the new oil. And so it's like, while you recognize that Mark Cuban would have been the last person you would have expected to get into healthcare, he's a very smart man, as we know, and he does think innovatively when it comes to building a business. It was all based on data that this, company basically pitched to him to get to where it is now. And where it really became disruptive is it was something that is appealing to everyone, that they wanted to cheer on for because of what it actually brings to the table for them, of lesser expensive drugs to do the same thing that they need to care for themselves, but they're noticing it and trusting it as well. So it's, those that can actually pioneer and grasp all of that, just by nature of design data that's coming in, and what they can truly translate that to, could be really impactful, and hopefully help us catch up so that we don't feel centuries behind anymore, and maybe only just a couple decades.
The Mark Cuban story was really interesting to me too, because that all started from someone sending an email that was like cold pitch.
Yeah.
And the idea that today of so many items are really over engineered of all these what ifs, and I can't come to the table unless I have an idea. That story is such a great concept of just try, like putting yourself out there can be such a huge item. So Stephanie, from your perspective, I mean, MedTech as an industry has always been really patient-centered, safety-centered, cautious as we're moving. How are you feeling like the AI and the hyper-personalized medicine, how does that play in to an industry that has been historically so slow-moving?
Yeah, Colleen, as everyone's been talking over the last few minutes, all I can think about is like the patient experience, right? Where let's say you're in the hospital, you're in a hospital bed. How much time are you actually seeing the provider caring for you, or the nurse caring for you? Or how much are you seeing the backside of their computer on wheels, or the backside of that individual while they're working on the computer on wheels? And I have hope, genuine hope, that the future with AI and personalized healthcare lends a world where we get to actually connect our human care providers back to our human patients. And we move these computers, which, the electronic health record was intended to do so many things, but it actually created such a burden. If we can just start there, you talk about the workforce, and you reduce percentages of time that are spent on that computer, and you pivot that to the patient. You talk about the heart of innovation. That's the heartbeat of our patients. That's the heartbeat of healthcare right there. So I have hope when we talk about AI that we're going to really reconnect our providers back to the human, the touch component, right? However, I have one caution for any innovator, any AI tech company. If you do not have a nurse or the healthcare providers that you're serving part of your team, you will fail. Hands down, telling you now. So and they can't just be your friend that you call and check in, they need to be part of the development. So when I look at AI and when I'm interacting with it, I'm looking not just at what's in front of me, but I'm looking at the people that are building it. And if they don't have my people and the people that are using it, I can tell you straight up, it's most likely going to fail. And what I've begun to see is some of our best of the best in the industry, clinicians, getting more involved in these AI and these real amazing tech companies. And I think that's a win for the industry. And I think it's a win for patient safety as well.
One of the big concerns that I have, though, just coming from, I have been a patient. I've been, I'm literally falling apart. I've recently had shoulder surgery. I started out the call with my ice pack on because it was so recent that I'm still in physical therapy from that. But I've done the genetic testing because I'm atypically symptomatic. And there was all sorts of stuff when I was first getting diagnosed about like, well, what's actually wrong with you? Many things. But, my parents would probably be like, there's something up here, too. But really, there's the insurance overlayment of insurance. We're talking a lot right now about, what care delivery looks like in medical technology and healthcare providers. But there is definitely an insurance component that we have to catch up with here, too. Insurance is not following pace on what those reimbursements or receivables are going to look like. And I do think that there's going to be an aspect of we're going to get some pushback probably coming up soon of providers are only going to be willing to utilize the tools that they can get paid for, unless it's something that eases their administrative burden or enhances their patient day, that it is going to become a factor. And one of the big things that there's been a lot of chatter about on my side, it's not in one of the articles I sent you guys in prep for today, but is about the CMS Teams model discussions. What's our baseline familiarity with that? So I know where to kind of start. We know a whole bunch about it, or let's start from the ground up. Okay. So the big thing with Teams is that it is really there's several different factors that are happening right now with Medicare. The Hospital Insurance Trust Fund that backs Medicare is projected to be completely depleted by 2036. It's 11 years from now, which is incredibly scary when you're thinking about that. And because the Medicare Advantage enrollment has soared, it's now covering about 54% of all beneficiaries, and that was by year end of 2024. So we're talking about there's not a whole ton of money there, and it's going to be going away even faster. So Medicare came out with the idea of Teams, and Teams is really decided. It started, a few years ago with some very small, like, hey, we're going to start this. We're going to start planning for it. There's some hospital enrollment. 2025 is the big year for hospital enrollment. There are certain cohorts of hospitals that are mandatory. You have to participate. Those are ones in which they're considering like core-based statistical areas. That's 25% of the eligible core-based statistical areas, mandatory participation, but there's also voluntary participation. It's covering, for the most part, how surgical procedures, and those are going to be your big ones, your bowel resections, your spinal fusions, your like coronary bypass. So those high dollar tickets, and basically saying that the procedure is going to cover the procedure and the treatment of it's going to cover not only that procedure, but everything up to 30 days from then. So if you're getting a readmit after a week, then that's all going to go back. So again, moving from fee for service into really procedure-based funding. I think that this is going to be a trend. We're going to see CMS roll this out, and I think we're going to see healthcare come along for the ride, where other insurance companies are going to take up that same model. What are some of our gut feelings on that?
Well, it is predicted that Medicare Advantage, they want to grow it because it's a way to do value-based care without really kind of calling it that, because people have these expectations of what that really looks like. So you're right on track. That's what some of the government and other consultants are really talking about. So it's really where we've been trying to go for the last 12 or so years. And it's really that balance between cost and care. And one of the only things that's been holding a lot of that, well, there's really two, is physicians want to really know how are they getting reimbursed. Mm-hmm. And so there's been a reluctancy on the actual healthcare organizations, but there's also the insurance. And so the big words are how agile and flexible can we be, as these things are expected to be rapid and not the slow healthcare way.
Abby, what are your thoughts on how, do you think that the Medicare teams you're gonna see ripples into private insurers, or do you think that's kind of like the government's always been a little bit of a beat of their own drum kind of thing?
So it's interesting because when you look at how a big part of the CMS reimbursement model and the best of the, I understand it, of course, is going to be on some of the more inpatient aspects. That's been just a majority of where I spent a lot of my time in my career. But it's interesting because CMS actually started to build that model when private insurance companies first started denying claims from hospitals on when that list of the never events first came out. So if you remember, I mean, that was back in the late 90s, early 2000s when they listed the patient safety, goodness, I'm now lacking the name of the original organization that it was, but when they basically released the list of events that should never happen to a patient when they're in the hospital, private payers got a hold of that and said, well, if you're going on record and saying that this is because of bad quality of care that doctors and nurses and bedside providers are actually doing to these patients, we're not going to pay you back for them. So CMS actually started kind of basing their model off of that. Now, of course, they function, and as you said, to the beat of their own drum. We see a lot of changes that are now happening to that program that we see moving forward, now going into, taking the more device-associated type infections, a lot of where I spend my world and all that kind of stuff, that's now changing too, where hospitals are going to be on the hook in the next few years for any infection that has absolutely nothing to do with the device and just something that the patient ends up getting by way of being in the hospital because of bad quality of care. So for once, I see the government kind of changing that, but it's because they realize the impact and the amount of dollars that they were losing and trying to hold the healthcare system back more on responsibility of the quality of care. But herein goes back to the problem, at least in my opinion, that we find is a lot of the problems that we have with quality of care is because of lack of resources and the ability to have the right amount of people actually caring for these patients that technology just still can't simply replace. Stephanie, I absolutely love your idea that some of this technology will hopefully actually get us locking eyes with a doctor or a nurse or a respiratory therapist or a physical therapist more often than what we're seeing now. I got to say, I'm still a little bit of a skeptic of it. And it may not be in our lifetime, but hopefully maybe in our great grandchildren's lifetime that actually comes back full circle. We can hope. And a lot of that, I'm actually also just saying off of, I've been trying to help my mom find a new primary care physician. She's, in a new life stage cycle that we need somebody new for her. And it has been the biggest challenge. And so she's been having to actually go back to somebody that is just not well as equipped to handle some of the problems that she's facing until she can actually get in on these 6-month waiting lists and heaven forbid that some type of emergency comes up. So I feel like it's a major dichotomy because there's all this pressure coming. And I love the idea of the accountability to provide good quality of care to patients and where that's coming from. And unfortunately, it all stems from the dollar. But we know a big problem is the fact that we are lacking bodies and resources to adequately do this job. And just as quickly as the trust fund is running out, I think we're running out of those people too. So not to be the Debbie Downer and paint the black cloud over it, but that is, I think, a little bit of where we're facing some major challenges. And hopefully maybe that's where some of these AI technologies can help us catch back up.
A lot of these ideas that we're talking about today, like when you first start reading about them, they feel like disparate concepts. Like AI is not the same as like what's happening with Teams, which is separate from like that hyper personalized care. But there really is such an overlayment to your point of what you just said, Abby, is that really these are interconnected ideas, that these Correct. Are all kind of going together. Stephanie, I guess one of the questions that I have for you is, this is a podcast for MedTech though. And what I'm hearing, it feels like, is a lot of opportunity that MedTech can capitalize on. There is room right now to not just take market share, but to be an industry thought leader. What are some thoughts on kind of direction to go from here? Or if you were getting started thinking about some of these concepts, where would you start?
With the patient. I'm genuinely serious. I think we can think about these big concepts, but if we don't hone in our thinking on what are the true needs of our patients that we're serving, whatever is created will fail. So I that grounds me in all things, right? As I'm listening to Abby speak, and Colleen and Barbara, to you guys talk about, the reimbursement side, we're really at this divergent fork in the road. You've got a healthcare industry that appears to be growing at X% without the growth of providers. That's a problem.
Oh yeah.
Right. And you've got this workforce, that I'm thinking of nursing specifically, that we've got 200,000 open positions every year between now and 2031. I think the most recent report said. So we've got to close that gap. But when you ask that question, Colleen, I'm anchored in the needs of the patient. And when we put ourselves there, you're the closest you could possibly be to the right solution.
Yeah. I love that as your guiding post.
This Barbara? Really goes to the concept we've been trying to talk about for years. And I think it's just really coming out. It's overall health. It's not just focusing on the hospital, because I've said this like a broken drum for a long time. And Abby just poked my bear here, is that if you're not taking care primarily, where those individuals or populations live, they're going to wind up in the EDs. They're all backed up right now because you've got norovirus, influenza, RSV, flu, COVID, all hitting, and you're getting all these things all backed up. No beds are available. We're running out of supplies in certain areas. I mean, it's and people to take care of them. So we've got to focus on this whole concept of overall health and be able to give Abby's mom what she needs where she is, or she may wind up in an ED or a hospital. So it's a perfect story that we're telling here.
Ladies, it's such a great conversation today. I'm so excited to be back in the new year with all of you. Healthcare in the US is central to our economy. It represents approximately a fifth of our entire GDP, which is crazy when you think about that. And those are not statistics that are going away. Innovation that we're bringing forward with AI and personalized medicine offer for this year strategic opportunities for people to really identify their organization as industry leaders, or really to fill in those cracks and gaps that currently exist. There's so much opportunity this year that I'm really excited to see the direction that we move to. Some other items to note over the overarching MedTech Business Academy. Barbara Strain, who is one of our co-hosts today, is also starting a new value analysis discussion podcast, which is incredibly wonderful. She's got some wonderful friends that are on that with her. Be sure to tune into that. And also on January the 28th at 11 a.m. Eastern, the MedTech experts will be hosting a webinar. The session's going to cover everything from developing a robust regulatory strategy and conducting patent search to prototyping and market validation. Learn how to access market opportunities, evaluate value readiness, and gather feedback and voice of customer to refine your approach. So really exciting to hop onto that. You can register for that on any of the MedTech experts' social media, or also on the Clinician Exchange's main website. Thank you guys so much for tuning in today to the Women in MedTech series within the larger MedTech Business Academy podcast. If you have not already done so, be sure to subscribe to never miss a future episode. Thank you.
Thank you.